Russian troops continue to advance in major cities in Ukraine, supermarkets are reporting running out of food, supplies, and water. And Ukraine accuses Russia of carrying out genocide after Russian aircrafts bombed a maternity hospital on Thursday. Joining me now is Ky Luu, COO of International Medical Corps. Ky, thank you for joining with me tonight. Mr. Luu, your organization is focusing on delivering relief to Ukraine through medical services and supply distribution. Many residents in Ukraine are now lacking essential supplies. Can you tell us more about what your organization has been doing on the ground and what you've been hearing from those in need?
Let me start off by thanking you for continuing to stay focused on the humanitarian crisis in Ukraine, which you've seen escalating due to the active conflict, the airstrikes, the targeting of civilians and critical infrastructure, including hospitals. International Medical Corps has been operating in Ukraine continuously since 2014, and our staff in country are reporting a desperate situation with hospitals that are overwhelmed with the treatment and care of trauma patients. And this is a health system that was already strained due to the COVID-19 pandemic, and they're lacking in medicines, supplies, equipment, and staffing. We're also very concerned with the likelihood of conflict-related rape and gender-based violence, as we witnessed in the early days of the 2014 conflict. Now, the focus right now is for the health system on the treatment and care of trauma patients, but there are other risks looming in the horizon. For example, the shortages in medicines and the challenges to access health care will exacerbate the burden of chronic diseases. The limited supply of oxygen will compromise the clinical management of severe COVID patients. And the displacement and the inadequate shelter and overcrowded living conditions due to the conflict will increase risk to women and children, but also increase the risk of infectious diseases.
Yeah, you know, one of the reasons why, Ky, I'm focusing on the humanitarian side of this is because people cannot, in my opinion, just think this is just Putin against Zelensky. They're real human beings. We're talking about maternity hospitals being bombed, children being abandoned, many displaced without family. I want people to understand the human cost of this. Vice President Kamala Harris said intentional attacks on Ukrainian civilians are war crimes. Do you agree with that?
Well, I will leave that to the governments and the ICJ to take up, but our focus right now is on the civilian population and the people who are affected by the conflict. And over the past month, we have deployed emergency response teams to the region, into Poland, Moldova, Romania. Inside Ukraine, we have scaled up our logistics and supply chain infrastructure to be able to deliver medicines and supplies to our hospital networks in Kyiv, in Mariupol, Odessa, Kharkiv. And that's really our focus at this stage, which is to ensure that the hospital system, the Ministry of Health, that local actors are able to provide continuity of care.
As Russian forces are intentionally trying to disturb Ukraine's food supply, how should civilians who choose to stay in the country, how should they respond?
So as we all know, there have been over 2 million refugees that have left Ukraine or are in the neighboring regions. But with all of the conflicts, we know that those who remain behind are the most vulnerable. And the lack of clean water, access to food, and access to health care is the humanitarian imperative at this stage. And humanitarian organizations like the International Medical Corps, who have been on the ground in Ukraine continuously, are working with the local authorities. It is critical that we're able to keep the Ministry of Health functioning, that we are able to provide people with clean water, that we're able to get essential medicines and supplies into their hands. So we are working with local actors, and most of our partners throughout the year have been Ukrainian organizations and groups, and we're seeing volunteers mobilizing. And we are trying to be able to support those actions above and beyond our own activities over the years.
Now, what can people who are outside of this conflict do to support and help civilians deal with essential supply shortages?
Yes. So it is critical, and we're already hearing news of in Poland and in the region and in Ukraine where the supply chain has limited capacity. And we want to make sure that any sort of resources that we are bringing into Ukraine or supporting Poland or Romania and Moldova are targeted. So getting lists of essential supplies and making sure that we're not flooding the system is critical. And that's why groups like the International Medical Corps, who are working with local authorities, who understand the essential lists and the commodities that are needed today, it is critical that we have the resources necessary to be able to procure and to deliver and make sure that they are going to where they're most needed.
What would you say, what would you personally say to those still in Ukraine to stay positive?
I would say that groups like the International Medical Corps, humanitarian actors, local and international, we are committed to staying and delivering. We've been there through the past conflict, and we will continue to be there with you today and tomorrow. Our staff are committed to this. Our organizations are committed to this. And we just want to make sure that they understand that we expect this to be a long-term response activity, and that we are committed to being there by their side.
Ky Luu, thank you so much for being with us this evening.